Health equity is at the heart of this year's World Health Day theme of building a fairer, healthier world. The COVID-19 pandemic has laid bare not just weaknesses in health services, but also deep inequities in access to health care across the world. The pandemic also makes equitable and universal access to health care even more important this year, with countries launching massive COVID-19 vaccination campaigns. Prioritized and equitable COVID-19 vaccine campaigns that leave no one behind are essential to curb the pandemic and recover from its devastating socioeconomic impacts. As happened with other diseases, women and vulnerable marginalized groups such as migrants, the disabled, indigenous communities, LGBTI people are often the ones most affected. And they're often the ones who do not get access to health services, including COVID vaccinations. With a strong commitment to the Sustainable Development Goals, the SDGs, UNDP is working with governments, other UN agencies, donors, civil society organizations, academia and the private sector to tackle the economic, social and environmental drivers of poor health, to improve governance in the health sector and to ensure that everyone has access to health services. In Asia Pacific, UNDP is now helping several countries to set up digital platforms for the efficient delivery and the equitable distribution of vaccines to all people. UNDP works closely with WHO and other UN agencies to help countries address these inequalities, to strengthen systems to improve equitable access to health services, and to tackle barriers facing vulnerable, marginalized people. UNDP is also working with WHO to help countries make health services more resilient to risk of climate change. As a co-sponsor of UNAIDS, we work also with countries to remove punitive and counterproductive laws and policies to ensure equitable access of HIV services for groups most at risk. As we mark a very special World Health Day this year, UNDP reiterates its strong commitment to work with its partners and to support Asia-Pacific countries to achieve the Sustainable Development Goal 3 on good health and well-being and universal health care for all by 2030.